Good morning. This is Dr. Kyle Smart with Cucamonga Valley Medical Group. A lot of people are asking questions about COVID-19, which actually stands for Coronavirus Disease 2019. Today, I want to discuss with you symptoms and screening for COVID-19. Why is this important to you? It's important to you for two reasons. First, it's March 19th here in Southern California, and we still do not have testing swabs widely available. So medical professionals are making recommendations based on screening and symptoms. Second, a lot of the public messaging coming from healthcare officials and government officials are telling you to call your doctors. And this information will help you be aware of what your medical providers are doing to positively impact this COVID-19 pandemic. In regards to screening, it is still important to know if you've traveled to an epidemic area or been in contact with someone who has already tested positive for COVID-19. However, since community transmission through respiratory droplets is already well known, a negative answer to these screening questions does not relieve someone of possible COVID-19 infection. Healthcare providers will check your peripheral capillary oxygen level, or SpO2, with a pulse oximeter, a simple device that attaches to a finger. Current recommendations are a pulse ox greater than 93%. Further evaluation and testing may happen. The symptoms are fever greater than 100.4 degrees Fahrenheit, 100.4. Many people will only have this symptom. Just because you have a fever doesn't mean you have COVID-19. As you know, many things can cause an elevated temperature. Second is cough. A lot of COVID-19 patients describe a dry cough. Hence, congestion may or may not be there. The data suggests that 80% of patients infected with COVID-19 will only have these mild symptoms, meaning you can stay at home, quarantine yourself there, and treat the symptoms with conservative measures. Again, if you have these mild symptoms only, please do not rush to your doctor's office, urgent cares, or ER for testing. The testing is not widely available yet. The final symptom that I want to discuss with you is respiratory distress or shortness of breath. If you are having shortness of breath or a hard time breathing, you do need to be evaluated at the emergency room. If the symptoms are severe enough, you may need to call 911. Please try to call ahead to the ER if possible.